Hello, I'm Dr. Jason Lowry. I'm a board certified and fellowship trained orthopedic surgeon with Arlington Orthopedic Associates. Today, I wanted to talk about total knee replacement. Knee arthritis is one of the most common ailments that we take care of, and a lot of times after conservative treatment has failed, we talk about knee replacements. This is what a knee replacement looks like. The portion of the knee that this doesn't show is your thigh muscle in front of the knee, which is called your quadriceps. Also attached to that quadricep is your kneecap. So what we do is we remove the arthritis under the kneecap and we attach an implant that will also glide back and forth in front of the knee. We make 5 cuts around the end of the femur and we attach a metal implant that looks like this. Traditionally, there's cement between the metal and the bone. And then on the shin bone side, which is called the tibia, we make a straight cut across the tibia and the implant looks similar to this. Which is a titanium metal. And between the metal components is this polyethylene. It's a durable plastic. And so this is how your new knee replacement is going to move, just like this. And so knee replacement is indicated in patients who have failed conservative management, primarily from knee arthritis. And the key is you'll hear me say, does this affect your quality of life? Is your life negatively impacted by this? And if the answer to that question is yes, then you will be a candidate for knee replacement. So if you have any problems with your knee, please come see me at our Arlington, Mansfield, and Midlothian offices.